Times are always tough for veterans out there, but it looks like the times are going to get even more tough for a lot of veterans out there. It looks like the administration, Elon Musk, President Trump, is talking about cutting 83,000 jobs from Veterans Affairs. These are the people that help veterans with all things veteran related, disability, education. And so I'm going to talk about that today. And hopefully it doesn't happen. Hopefully we can push back and stop this. But it's always good to have a plan B. And I'm going to talk about some of those today to protect your finances, to protect your family, protect your health. All right. So if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. And in my previous life, I was a sergeant in the Marine Corps. I think I actually had more hair now than I did then, but just in all the wrong places. All right, so let's get into this. This is also a live Q&A. I usually do my live Q&As. I do a video pretty much every day talking about all things Social Security, retirement, Medicare, disability, survivor benefits, spouse benefits. And I'm going to do that here in a few hours at my regular 3 o'clock West Coast time. But considering the veterans out there really need some help and options. So I just wanted to jump in here real quick and see what I could do. Okay, so disability. So there's a lot of veterans out there that are on disability, 10%, 20%, 30%, whatever the case may be. Social Security doesn't have that type of a system. They have disability, but it's either permanent disability or nothing. And so the definition of disability for Social Security is the inability to work. So your disability has to last 12 months or longer and prevents you from working substantially. What is substantially? Well, this year it's $1,620. So if you're making over $1,620, then you wouldn't qualify for Social Security. There are some little bit exceptions in there, but I've got a few videos on how to file for disability and make sure you're approved. And how does the VA disability affect Social Security disability? It doesn't affect Social Security disability. You can have veterans disability and Social Security disability. My office, being an old vet myself, I had a lot of veterans in my office and they were receiving VA disability, 10, 20, 30, 40%, but obviously they were not receiving Social Security disability because they were working. So if you have a disability that's going to last 12 months or longer and you're unable to work, please file for disability from the Social Security Administration. I've got a series of 3 videos up on my channel, and it tells you all the tips, tricks, and secrets. Probably the most important thing right now, given everything, because not only the Veterans Affairs are losing, thousands of employees. Social Security is also going to lose probably about 20% of its employees, and they were already down to a 50-year low in terms of staffing. So I think we're going to be returning to 1935 levels in terms of help for people getting their benefits. So it's going to take a long, long time to get your disability claim approved, unfortunately. But the sooner you start, the better. And there is a program called the Wounded Warrior Program for Social Security. There's a lot of Wounded Warrior programs, but Social Security has one that essentially depends on your disability and other factors, can expedite your claim. And, it really expedites your claim. If I was saying this last week, I would probably be telling the truth, but given the fact that, you've got to have actually employees to actually expedite the claim. And but it should help. And I put the information in my YouTube channel description. You can go to my YouTube channel description. If you're watching on any other platform, just type in Dr. Ed or Ed Weir or MyGov Expert, and you'll see my face pop up. And just go to this particular video and go down to the description, and you'll see the link to the Wounded Warrior information. Okay, now with your health care, people, were dependent on the VA clinic in their particular area. And now with, cutting back of staffing, and we don't know with the Social Security Administration, then I'm going to be doing a video here in a little bit about Social Security, and there's no rhyme or reason on the cutbacks. It's not, kind of, well thought out. It's just, get rid of people, as we used to say in the Marine Corps. And I'm sure you used to say you're voluntold to leave. So there's no rhyme or reason. So In your particular area, you might be good. Everybody might stay in your particular VA clinic. Another particular area, you know, everybody might leave or be voluntold to get out. So you don't really know. So a lot of VA, a lot of veterans have, up until now, they're like, hey, I'm good with a VA clinic. I've got no issues there. I'm happy with them. Good customer service, good doctors. I like them. Um, so if you are eligible for Medicare because you have disability, when you get Social Security disability, you're eligible for Medicare after 2 years. If you're 65 years old, then you get Medicare after 2 years. So a lot of veterans, they said, well, I've got the VA, so I don't want Medicare. In order to get my monthly benefits, I have to get, Medicare Part A. That's fine. It's zero premium. But I've refused Part B because, this year it's $185. And, if you would have told me that last week, I would have said, perfect. Awesome. Yep. Good choice. Save yourself the $185 if you don't really need it. But things are changing now. You just might need it. And I'm just throwing this out there as something you need to think about. And this is the time. There is a deadline. It is called the Medicare General Enrollment Period. January, February, March, you can enroll in Medicare Part B, as in boy, bravo, and your Medicare will start the next month. So this is March. If you get this done immediately, if not sooner, then your Medicare Part B will start April 1st. In the old days, it would start, if you started January, February, March, it wouldn't start till July. They changed that law a few months ago, about a year or so ago now. And now it'll start the next month. So that's a great benefit. So get your Medicare B started. And you're like, well, I still don't want to spend the $185. Okay. There's options. Obviously, if you're very, very low income, you reach out to the social services, Department of Social Services, Department of Welfare, Medicaid office in your particular state, and you apply for Medicaid while it still exists. So hopefully that doesn't get cut back as well. But apply for Medicaid, and you can have Medicare and Medicaid. There are millions of people that have both. You become dual eligible, Medicare and Medicaid. And if you're approved for the higher levels of Medicaid, the state will pay for your Part B premium, that $185. So you can kind of, have your cake and eat it too. So you'll get all these extra benefits as well. And if you're dual eligible, Medicare, Medicaid, you're also eligible for what's called the Medicare Advantage dual eligible plans. Everybody that regular viewers on my channel know I always recommend Medicare supplement plans instead of a Medicare Advantage plan. But if you have the VA and Medicaid, if you have Medicaid, you can't get a Medicare supplement anyway. But you can get a Medicare Advantage dual eligible plan if you get the higher levels. And this is why I've reached out. I've partnered with Chapter Medicare, and you can give them a call. But if you're going to check out that option, you've got to do it before March 31st. Okay, there's more options though. So Medicaid is one option, but remember you have to for Social Security, you need to contact Social Security and get set up for Medicare Part B. And yes, if you didn't sign up for Part B when you were supposed to, there's going to be a penalty, unfortunately. So if, anytime you delay signing up for Part B, and there's a lot of veterans out there that said they're not going to do it because they were happy with the VA. But if you're thinking about that option now, then you're going to get penalized, unfortunately. 10% for every 12 months you did not have Part B after you were, first eligible for Part B. If you had health insurance from work, yours or your spouse's, and that work had 20 or more employees, you did not have to sign up for Part B, and you're not going to be penalized. But if you didn't, then unfortunately you just might be penalized. Again, you can reach out to Chapter there. They can check your particular plan, your particular option, your particular situation, and see what's going on with you. But March 31st is the deadline for signing up for Medicare Part B under the general enrollment period. If you've recently lost your work, or you're going to lose your work, you lose your health insurance. If you're going to lose your health insurance from work next month or 2 months from now, that's fine. You're in a special enrollment period, so you can apply for Part B next month or 2 months from now. You have 8 months after you lose health insurance from current work. Okay, so there's another deadline, March 31st deadline, and this is the Medicare OEP. the open enrollment period. It's crazy, right? The whole thing is anyway. So the open enrollment period is if you already have a Medicare Advantage plan and you want to switch that Medicare Advantage plan, or you forgot to check that Medicare Advantage plan, you have a do-over. You can check your Medicare Advantage plan right now until March 31st and switch to another Medicare Advantage plan. So there's a lot of people out there that forgot to check their plans during the annual enrollment period from October 15th to December 7th. And there's about 1.8 million people that had their Medicare Advantage plans canceled. The 2025 is the most chaotic year for Medicare in decades. So a lot of people miss the deadline and they think they're stuck, but they're not. You can actually switch to another Medicare Advantage plan right now. Yeah, one time, but you have to do it before March 31st. And again, reach out to Chapter. They can help you out. And veterans, here's what I have always recommended to veterans that don't want to pay the $185 and want a plan B, want a second option, a fallback option if VA goes south. And that's called a Part B give back, a Medicare Advantage Part B give back. And a lot of these are called like Patriot plans or Freedom plans, and it's directed to veterans. And what it is these Medicare Advantage Part B give back plans, they do, as the name implies, they pay part of your Part B. It depends on your particular area, $50, $100, $185. And so you could kind of have your cake and eat it too. You can continue to use the VA, but you have a backup that's not costing you very much because you have a Medicare Advantage that's paying for part of your Part B. So there's a lot of veterans that have those and they just kind of, gone on automatic pilots and said, well, they're paying for my Part B and I'm good, but I've never really used them. I would definitely reevaluate those. I would review that plan. If you haven't checked that plan in a couple of years, because those plans change every year, you might say, oh, they're still paying $100 a month. And so I guess I'm good. Well, no, they jacked up the prices. Maybe there's another plan in your area that pays $150 and, it's less cost if you have to go to the hospital or see a doctor or something like that. So definitely check those out. That's one of the issues with Medicare Advantage plans. They change every single year. And people always say, well, I've had the same one for 5 years. No, you haven't. You've had the same card, maybe, in the same company. But those plans change every single year. And, last year you had a Corvette and it turns out, they put a Pinto in your driveway this year. Sorry, Pinto lovers. So check your plan. Definitely check your plan. Again, general enrollment period, March 31st. The open enrollment period, March 31st is the deadline. Review your plan. And for those on TRICARE, so you should be good. Myself and Chapter don't really recommend Medicare supplement plans in like a Plan N or a G because your TRICARE is your Medicare supplement plan. Medicare Advantage, some people try to sign you up for Medicare Advantage if you have TRICARE for life, but not really. You should be good. Again, that I'm going to keep an eye on this. Me and Chapter said last week you should be good, but this is a whole new world out there, so I'm going to keep up on this. And even though I'm an old veteran myself, I spent 8 years in the Marine Corps as a sergeant. I'm good on Social Security and Medicare, but not too much on veterans type stuff. How to file for disability and education and all that kind of stuff in the Veterans Administration. So I'm looking for someone that wants to appear with me, one or two people. If you're a specialist on, if you've been taking veterans, disability claims for decades and you've recently got voluntold to leave, or you worked for veterans and other type of benefits, please email me, ed@mygovexpert.com. Give me a little kind of a synopsis of your experience, and we might do a live Q&A where we'll pop you up there and answer a bunch of questions for all the vets out there. And I want to throw one little nugget out there. VetTix. Hopefully all veterans know about that. VetTix.org. I'll give a little plug for them. I've seen Jewel and Tony Bennett and U2 and George Strait all for basically free. $10 or something like that. So check out VetTix and maybe make your life a little bit easier while the world around us kind of collapses, I guess. So, all right, I'm going to answer a few questions here, but again, I'm going to be back here in a couple of hours and go through um, all the other questions. But I just want to focus on. I'm sorry if I'm going to skip your question, but I want to focus on VA veteran type stuff here. Thank you for your service, and you are still serving. You're welcome. Thank you. Can veterans collect both non-service connected VA benefits and SSI? SSI is the welfare-based program, supplemental security income. It's the welfare-based program the Social Security Administration administers, but it's low income, low resources. You probably mean disability, SSA disability. Yes, you can. Yes, you can. You can collect VA disability and Social Security disability, 100%. So yeah, a lot of people out there think, it's going to mess up. And it's actually under normal circumstances, even if you don't qualify for the particular Wounded Warrior Project, expedited, um, to get a disability claim approved from the Social Security Administration, if all of your medical records are in the VA system, it's usually quicker because the VA and SSA, their computer systems kind of talk to each other a little bit. So it's usually a little bit quicker. So yes, if you are collecting disability from the VA, please, 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 yes, reach out. Let's see here. The VA has serious issues. Yeah, yeah, but throw the baby out with the bathwater. They should be kind of selective. It's okay, just like the Social Security Administration. I'll talk about that in a little bit. Yeah, a lot of people are going to be hurting, unfortunately. I'm an American citizen born abroad and living abroad. Do I have to go back to the States to apply for Social Security, or can I do it from American Embassy? Yes, you can do it from an American Embassy. A lot of vets going, overseas, so this might be a vet. Yeah, it's called the FBU, the Federal Benefits Unit. So reach out to your, the consulate, American consulate, or American Embassy, wherever you are, and tell them you want to file for whatever benefits, and they will definitely help you out. Let's see here. Ed, hope all great information given us. You're welcome. I have a question. My family enrolled in Medicare Part B effective May 1st and also enrolled in the Advantage, but the account we can't see. So yeah, you're probably going on to Medicare.gov or something like that to see if you can see it. So it might just be, until the system catches up, you're not entitled. It doesn't start till May. So just possibly just give it a little bit of time. They might have fired. I know they've so unceremoniously vacated the premises of the Office of Transformation. That's the Office of Social Security Administration that helps with online SSA type stuff. And yeah. I'm glad you are devoting your podcast to our veterans. Thank you for much care. You're welcome. And please reach, if this doesn't apply to you, if you're not a veteran, I'm sure you know a veteran, forward this this video to them, and hopefully they don't need it. Hopefully it's just a waste of their time, but yeah, and share and like, and that gets the algorithm out there. So Trump and Musk have no respect for veterans. Thank you, Dr. Weir, for doing this video. Yeah, you're welcome. Yeah, they're just trying to cut the budget, which I can see obviously, but you have to do it in a halfway logical way. Let's see here. I'm jumping through these questions, trying to find a veterans type question. My ex got 100% permanent and total disability through the VA, and they instructed him to go to Social Security to apply permanent disabled for 100% Social Security automatically. Of course, this was 20 years ago. He is now deceased. Wow. Yeah. Yeah. Any level, if you're getting, the VA does their, calculations, their eligibility different. So, I'm only getting 30% from the VA, but 30% service connected, and you might have other disabilities. So even if you're 30% from the VA, you might be, 100% from Social Security. Again, Social Security only has, basically 0, 100%. Let's see here. Only alternative health science tries to treat the cause of hospital franchise use symptoms. Okay. So let's see. I'm not that type of doctor, so I'm not going to, I just started spousal support. I'll be 65 in September. Don't bother applying for Medicare. Just started spousal support. Yeah, I mean, that's some alimony type stuff. But yeah, if you're 65 and you do not have health insurance from current work, yours or your current spouse's, then you have to sign up for Medicare, Part A, Part B. If you don't, then if you sign up later, if you sign up 5 years later, you're going to get charged a 50% premium penalty for Part B, and you're also going to get a penalty for Part D, the prescription drug plan. So yes, you definitely need to sign up there. Let's see, my 60-year-old, I'm a 60-year-old woman on SSDI for 18 months now. My disability is permanent and was told 5 to 7 years before reevaluation. Do you think this will still be true? The continuing disability reviews, the CDRs, I think they're going to be increased substantially, possibly, because that's one of the target. That was the target during the previous Trump administration, was people on disability benefits. So I think that's going to be a target. I did a video about 4 or 5 days ago that I go over. So make sure you watch that video. Just go back to my YouTube channel and look at my live that I did, I think it was about 4 or 5 days ago. And I tell you about, CDRs and how to protect yourself and to make sure that, your disability continues. Veteran is a veteran. What's non-service mean? That just means basically that, whatever injury they have was not necessarily service connected. It wasn't, while they were in, active duty or, whatever the case may be. So if they have just other, they were out skiing and, broke something. And will wounded warriors help surviving spouses with VA claims? Not this. Yeah. So a lot of organizations use the term wounded warriors. But in terms of Social Security, this just a wounded warrior is a category of disability claim that they treat differently. They expedite it and all that kind of stuff. But yeah, if you're a surviving spouse, yes, reach out to the VA and hopefully they should be able to help you out. But yeah, for Social Security wounded warriors, no. In New York State, there's a Medicaid QI program that's right now pays our Part B, correct? So usually the QI, the qualified individual, the SLIM-B, the QMB, the qualified Medicare beneficiaries, those are part of the Medicare savings program. So we do not qualify for Medicaid as our income is too high. So maybe some could check this out. Yeah. So the QI, so that's so you do have Medicaid, then the QI program. You just have a different level of Medicaid. Some people have the lower levels of Medicaid, and it's all kind of different. The states are a little bit different, so they do things a tad bit different. Medicaid is a partnership between the state and the federal government. The federal government has some general guidelines for Medicaid, but there's a lot of flexibility for the states. Dual eligible, I believe you cannot make more than $2,000 per month. Well, that's not necessarily dual eligible. For Medicaid, yes, in most states, $1,500, $1,600, $1,700 a month. If you make more than $2,000 in most states, yeah, you're not eligible for Medicaid, and therefore you're not eligible for dual eligible, right? So, that's more of a Medicaid type thing. Medicare, it doesn't matter. You can make $1 billion a month and still get Medicare. You'll pay a higher premium probably, but there is no qualification for Medicare like that at income or anything. All right. I'm on SSDI and collect 25% of my ex's benefits. Can I apply for SSI benefits under the new rule? SSI is the welfare-based program. If you're making over $967, which is the max you can get on SSI, then no, you would not be eligible for SSI. Non-service connected is a very small benefit for very low income vets. Okay. Different terminology of it. Okay. What can I do when SSDI claims there is an overpayment and there is not? Do I need to hire an attorney? You can hire an attorney, but they're going to want cash up front. Disability attorneys, that handle Social Security disability, if your disability is approved, they take 25% of back pay up to $9,200. I think it just changed. But on an overpayments type stuff, yeah, attorneys really don't do those unless an attorney will do anything if you pay them a whole bunch of money. But no, if you can find an attorney, go for it. But the easiest way to do it is just file an SSA 632, request a waiver, file an SSA 561, request a reconsideration of that overpayment. And unfortunately, it's gonna be a nightmare because Social Security is, they're losing people left and right. So it's going to be very hard to get your benefits, get a hold of Social Security, get issues addressed. Is that plan available for spouses of veterans? The Part B give back? Yes. The Part B give back. Good question. Yes. There's different kind of versions of it. There's like a lot of the Patriot plans, they don't have drug coverage in it. Most Medicare Advantage plans have drug coverage embedded in them. But since the Veterans Administration has really, really good drug coverage, good prices for drugs, prescriptions, then and because they're able to negotiate, unlike Medicare until recently, so the Medicare Advantage, those plans are usually just Medicare Advantage without the drug plans, but they do have the Medicare Advantage with the drug plans and maybe a Part B. But yeah, you don't have to. But word of caution on the Medicare Advantage Part B give back. Um, these these are provided by private companies, and these companies are in it for a profit, so they're not going to give you 185 pay for your Part B premium $185 a month unless they get it someplace else. So if you have a Part B give back plan and a regular plan, and there's like the company pays $185 every month, for you, and this one doesn't, this one's going to say, well, we need to find that money in other places. And so they might charge you $200 a night for hospital. This one might charge you $100 a night. This one might charge you $50 for a specialist. This one might charge you zero. And most veterans just wanted to get the money for their Part B paid. So they like, well, I don't care. I use the VA anyway. But now the situation might be changing. So just kind of when you call chapter or whoever, check and say, okay, I appreciate the extra $100 a month or $185 a month, but if you're relatively healthy, and then that's fine, then hopefully you won't need it. But just kind of be aware of that. It's always in the details, and remember, you can change those every year. So if you change it and you get that $185 or $150 or $100 a month paid back every month from your for your Part B premium, and then you keep it for several months, and you're like, well, it's like I might have to go to the doctor next year, and there might have more issues, so I want one with better coverage rather than paying me $100 a month. So I'll switch, and you can do that during the annual enrollment period, October 15th to December 7th. And then your new plan will start January 1st. So that's the trick on Medicare Advantage plans, is you've already paid for these. People say, how can they be zero premium? Because you already paid for them. When you paid your FICA, your FICA payroll tax, it includes Social Security and Medicare. Medicare is 1.45% you pay, and your employer pays 1.45%. You paid that for decades. And when you sign up for a Medicare Advantage plan, that's where that money comes from. It's your money. You're just getting it back. So if your Medicare Advantage plan, has dental, use it. You paid for it. If it has vision, use it. Pay for it. If it had gym membership, use it. Pay for it. You paid for it. So I turned 65 in July. Do I have to apply by March 31st? No, you're in the special enrollment period. So you're good. So if you are currently receiving Social Security benefits, you will be signed up for Medicare automatically. About 100 days before you reach your 65th birthday, you'll receive your Medicare A, B card in the mail and everything. If you don't need Part B, then it'll give you instructions on how to return it. If you're not receiving Social Security benefits and you don't have health insurance from work, yours or your spouse's 20 or more employees, then yes, you have to sign up. So contact Social Security, go online, and make sure you do everything 100% right, because if something doesn't go right, then unfortunately there just might not be people in your office to help you out. So, what's the best age to retire between 62 and 65? What should they consider for healthcare needs? Any helpful suggestions are appreciated. Yeah, when you should retire, it's completely up to you. Your particular decision, your particular situation. Do you need the money? Are you working? How's your health? How's your genes? And all the rest of the stuff. So, yeah, it's really a one-on-one type thing. But in terms of healthcare until you turn 65, the Affordable Care Act, marketplace insurance, Obamacare, whatever you want to call it. So people sign up for the Affordable Care Act, until they reach 65. And then when you reach 65, you have to switch over to Medicare. You don't have to, but you're going to lose all your subsidies and you're going to get penalized if you don't. So almost everybody switches over. So, Dr. Weir, keep the knowledge coming. Thank you for your hard work you're doing. You're welcome. Thank you. Let's see. My wife is currently receiving Social Security disability only. She just received a settlement from a third-party insurance. Would her SSDI be affected, and does she need to report to Social Security? No, no. It's the only time it affects Social Security disability. So the Social Security part is if it's like workers' comp or a public disability benefit, like from the state or something type of workers' comp. But if you some type of third-party insurance, no, that doesn't. The only thing it might, so it's not going to affect SSDI, but if she has Medicare or any health insurance, and like she had an accident or something, and because of the accident, she had to get $100,000 surgery. And then you get the settlement, and part of that settlement is $100,000 for medical costs. The insurance company and Medicare is going to come after you and say, hey, we shelled out $100,000 for your surgery because you needed it at that time. Now you just got $100,000. People think, well, I got an extra $100,000. It's already been paid by my health insurance cover at Medicare. No, they'll get their money. So, Lori, did I miss something? Why is Ed on live right now? Yeah, I wanted to jump out there and do a second live. So I'll be back here in a couple hours and do the other one. So, and I'm going to keep the live Q&A a little bit short here. I want this to be a shorter video. That way it hopefully goes out to more veterans. So please share this video. So let's do one more question, and hopefully it's a veteran type question. Let's see here. Thank you for helping vets. Thank you. Appreciate it. I heard the SSA website no longer has IT server. Yeah, they essentially got rid of the people that are updating the Social Security SSA.gov website and my Social Security and stuff. So it's crazy. Okay, here's a veteran's question. If you need help with the VA questions or help with paperwork, you can reach out to the veteran service organizations like the VFW, the DAV, or the American Legion, etc. Thank you. Who is that? Fred E. Thank you, Fred. I appreciate it. You're awesome. Thank you for that information. All right. Let's get one more and then we'll call it a day. I recently took my DD Form 214 and medical records to the local VA to get in the system. They told me they couldn't do anything for me. How do I get in the system? Take Freddie's recommendations. So I'm not sure what type of system you're talking about. You're trying to apply for disability benefits. So yeah, I would definitely reach out to one of those organizations and see what's going on. And again, if anybody work for the VA doing disability and stuff, please email me, ed@mygovexpert.com, ed@mygovexpert.com, and say, Ed, I worked for the VA for 20, 30 years and I just got, relieved of duty. And you're willing to come in and answer questions during the live Q&A if you helped veterans with educational type stuff. Yes, I want it. I want this channel to be a resource for everybody out there: disability, retirement, survivor benefits, veterans benefits. I don't know if I'll ever get into taxes, but I don't know, maybe. I'm definitely not going to give that advice. Been trying to cancel my subscription to the IRS for decades. All right. That is it. I'll be back in a couple hours and we'll talk about the Social Security Administration and how to navigate that, the dying organization that is SSA. It's unfortunate. All right. Y'all take care. Take care of each other. Please share this with any veterans you know. Thank you. Take care.